welcome. I'm Dr. Punit Saravi and you are at Everything Skin and Hair Medical and Aesthetic Dermatology Clinic. So once a patient told me that she never feels completely dressed until she's done her brows. And to think of it, it's so true. A pair of eyebrows which seemingly don't do any work for us defines our faces, it frames our faces, it gives us the youthful appearance. Most of us may be born with picture perfect eyebrows, but over years there are a lot of changes which happen on the brows. The skin around the brows start to lose elasticity. We may lose hair in the eyebrows for many reasons. You may meet with an accident and have a scar on the eyebrows, which lead to loss of definition of the eyebrow shape, the color as well as the density. Generally, brows are often neglected and it's the last thing that we pay attention to, but we fail to realize that when you meet someone socially, it's the first point of contact. Your eyes and your eyebrows are just sitting there. So we have many different technologies to get that perfect eyebrow renewal. If someone is losing the arch because of laxity of the skin around the brows, HIFU is an excellent technology. That stands for High Intensity Focused Ultrasound. It's an energy-based device which is used to create collagen in your own skin. So how it works is it basically penetrates the skin at a depth of 3 to 4.5 millimeters and creates pockets of heat, which is like a stimulus for your skin to produce more collagen. The second technology that we use is microneedling radiofrequency. This works at the depth of around 1 to 1.5 millimeters. Again, it creates channels of heat in the skin. It also has microneedling, which is again that little micro stimulus for your skin to produce more collagen. Sometimes we have excessive eyebrow hair, unibrows, hair on the eyebrows which extends up to the forehead. All of this can be dealt with permanent laser hair reduction. We can work on unibrows to do a mid-brow so that you don't have to pluck hair in the mid-brow area. There are various peptides and serums that can be used at home to stimulate the eyebrow hair development. If there is a specific pathology because of which you're losing your eyebrow hair, for example alopecia areata, the clinic also offers specific target-based therapies for those pathologies. The two non-surgical eyebrow lift options that we have, one is botulinum toxin. It's micro doses of botulinum toxin, popularly recognized as Botox, at the right point gives you a nice glamorous arch of the brows, especially towards your side of your brows. And the second one is derma fillers. Derma fillers, we use hyaluronic acid collagen fillers, which are again given over the eyebrow orbit, which revolumizes that area and recontours your brows. Today we'll be discussing the seventh technology at the clinic, which is microblading. Microblading is conventionally offered in tattoo parlors across the world. My interest in microblading started with my passion for sketching. And a few years ago, I had a lot of patients of alopecia areata who used to lose their eyebrow hair and they used to be extremely uneasy with their appearance. So I started microblading for these patients to build their confidence, and I soon realized the versatility of the procedure. And I've been using it, combining it with other laser techniques to give the best possible results to achieve envious eyebrows. So today we have a client and she's very excited to do her brows. We are going to do microblading for her eyebrows, and that's an artistic and a scientific way to densify your hair. It mimics your hair strokes and it's very natural. The results are long lasting, up to a year and a half, and it's super safe and you walk out with a perfect pair of brows.
I do like my eyebrows, but I just find it a little cumbersome now to fill it every day. So I've been filling my eyebrows literally every day for the past many years. And I have seen the results of your microblading, and I would like to do microblading so that it's much more easier and it looks more fuller and better. So could you tell me a little more about microblading?
So you've actually correctly identified your brow bit, and if I can just point out a few things, you've got beautiful features, and eyebrow is something which will frame your face, and between both your brows as well, the one on the right has a better arch than the one on the left. The left is a little bit flatter than the right, and I'm sure when you're filling in you would want this brow to look as good as this brow. Having said that, the body of the brow is still good. The beginning, the head and the tail could do with a little bit more filling in. So exactly what you're doing with your pencil, we can mimic that with microblading. and it's here to stay. You will have those results for more than a year. You can wake up to your brows. So what exactly we do in microblading is we deposit pigment, and these are US FDA approved pigment for safety, and these are deposited into the outer layer of the skin, and it's done with a handheld tool. It's called a microblade, and what I mean by that is it's basically bunch of tiny needles which are tied up together, dipped in the pigment and deposited in the outer layer of the skin, and it's done in a lifelike fashion. So it's a very artistic technique. We draw each single stroke of hair so it looks and mimics your eyebrows very well. The color that is chosen is also very close to your existing hair, so it blends in very well with your eyebrows.
So is it tattoo?
No, it's not a tattoo. A tattoo is done with a machine, and in that the pigment is deposited into the deeper layers of the skin, making the procedure permanent. However, when you do tattoo on the eyebrows, over a period of time, the strokes lose their crispness and they don't look lifelike, and also the pigment changes colors. So after a point of time, a tattooed eyebrow looks more crayoned and artificial. That does not happen with microblading because it's semi-permanent.
Okay. So I have a quick question, doctor. Is it very painful?
It's not painful. We do use a numbing cream. The numbing cream will be put onto your brows for around 45 minutes. Will make the procedure comfortable and manageable. It's like minor paper cuts on the skin. It's like someone is scratching you with a pencil, that kind of a sensation. It's not painful.
Okay, great. So I'm really looking forward to the whole thing, and I just can't wait to see my new eyebrows.
Great.
Thank you.